Transfusion Therapy Updates in Treatment by Sarad and Daniel Rodriguez. Transfusion therapy involves the use of blood products, a type of biologic drug. They work by increasing the colloid oncotic pressure and plasma volume by pulling fluid from extravascular space to the intravascular space. Red blood cell products are also able to increase the transport of oxygen throughout the body. There are a variety of blood products available to blood transfusion. They are fresh frozen platelets, packed red blood cells, plasma protein fraction, whole blood, and cryoprecipitate. Indication for use can be to manage acute bleeding to increasing clotting factors levels in a patient. For this presentation, we will be using packed red blood cells as the example. This particular blood product increases oxygen carrying capacity in patients with anemia, substantial hemoglobin deficits, and those who have lost up to 25% of their total blood volume. It is important to know there are different types of blood, A, B, and O, and a protein called Rh factor that may be present on the surface of red blood cells. These will be examined and prepared by the blood bank so that the blood given is safe for the patient to receive. Nowadays, the blood bank also screens for any possible infections like HIV in the blood, as well as removing leukocytes and irradiating the blood to reduce the occurrence of an immunologic reaction in the patient. Now that you know about the blood product, let's discuss the process of a blood transfusion, as safety and following procedure is important. Your patient Guadalupe needs blood transfusion. She should be informed of the risks, benefits, and alternatives to receiving a blood product by her physician. Be sure that consent is obtained from the patient. Be sure to teach Guadalupe to report any signs or symptoms of a possible adverse reaction to the blood product, which may include fever, chills, pruritus, hives, dizziness, severe back pain, difficulty breathing, or anxiety. Be sure to gather the proper equipment for the procedure. Typically, an 18-gauge catheter is used but can be larger or smaller to accommodate the patient and/or situation. The tubing used usually will have a Y port that 0.9% normal saline is connected to prime the tubing. Do not use this port to infuse dextrose or lactated Ringer's solution as it will cause red blood cell hemolysis. Do not use any additives or medications in the same tubing unless it is cleared with normal saline. The tubing should not be used for more than 4 hours but can be used to administer multiple units of blood if it is the same type and compatibility as the previous unit. The tubing will use a microaggregated filter that allows the blood product to flow through, while preventing any blood clots and blood cell aggregates from entering the patient. This filter can be used for 2 to 4 units of blood, depending on hospital policy. A blood warmer can be used to warm blood to 37 degrees Celsius to prevent chills and cardiac arrhythmia from a rapid infusion of cold blood. Pressure bags are another tool for a rapid infusion, giving a whole unit of blood in 5 minutes. Once the blood arrives from the blood bank, there are several things you, the RN, should do. Performing the 3 rights: right blood component, right patient, and right time, with another licensed individual that may be another RN or a LVN. Did you know 90% of hemolytic transfusion reactions are from failure to match the patient to the appropriate blood product? Be sure that blood begins transfusion within 30 minutes of arriving at the nursing unit. Otherwise, it should be returned to the blood bank until the procedure can be performed. Take your patient's vital signs prior to beginning the transfusion to act as a baseline for any changes that may occur. If there is an abnormal vital sign, inform the physician and give the transfusion when the physician decides it will be acceptable to proceed. The rate for the infusion once it begins is a rate no higher than 25 to 50 milliliters per hour for the first 15 minutes. There should be no more than 2 milliliters per minute being transfused during that time. Be sure to assess for any signs and symptoms of any adverse reactions. After the first 15 minutes, be sure to take Guadalupe's vital signs again and assess her condition throughout for any of the following acute transfusion reaction. Occurs, do the following: stop the transfusion, maintain IV line patency with a saline solution, notify the blood bank and healthcare provider immediately, recheck the identifying tags and numbers, monitor vital signs and urine output, treat symptoms per physician order, save the blood bag and tubing and send to blood bank, complete transfusion reaction report, collect required blood and urine specimen according to hospital policy, and document on a transfusion reaction form and the patient chart. If all is well, the rate can now be increased, typically to 1 unit transfused over 2 hours. The transfusion should not exceed a 4-hour duration. Stop the infusion and send the blood product back to the blood bank if this is the case due to the risk of bacterial growth. Be sure to take Guadalupe's vital signs again 30-minute mark after transfusion begins, then again at the 60-minute mark and every hour after until infusion is complete. After completion, assess Guadalupe an hour later and continue observing her for 24 hours for any of these delayed transfusion reactions. Over a third of adverse reactions can occur hours later. Congratulations, Guadalupe has had a successful blood transfusion. While most of this procedure is universally followed, there are parts that vary, including the priming of the tubing for the blood product. Nurse practitioner Christine Kessler discusses this in her article titled Priming Blood Transfusion Tubing, a Critical Review of Blood Transfusion Process. She shares that the practice of using normal saline is not evidence-based and only accepted that normal saline will allow for better evacuation of air bubbles, prevent damage to blood component from the filter, and to dilute the blood for easier flow. When in fact, correct filling of the tubing would prevent any air bubbles, the filter causes little damage to blood components, and blood products are already diluted enough for easy flow. Do not mistake this for the absence of using normal saline in this procedure. It is still universally agreed that infusing a small amount in between units to ensure that all the blood is delivered and to keep venous access available until the next unit of blood is ready. Ultimately, the most important part of blood transfusion therapy is adherence to your hospital policy to reduce any unfortunate outcomes of treatment and keeping your patient safe.